Our PSA is on mono, and it'll cover what it is, how it spreads, treatments, and why it's important not to get it. So mono is usually caused by the Epstein-Barr virus. It most frequently occurs in young adults and teenagers, but it's pretty common with 3 million cases per year in the US, so really anyone can get mono. You can get diagnosed by a healthcare professional by either describing your symptoms to them or doing a blood test for antigens. The symptoms of mono are similar to any other viral infection. These include fever, head and body aches, sore throat, etc. These usually improve within 2 to 4 weeks and aren't too severe. Occasionally, fatigue will last longer than those 4 weeks, and in extreme cases, a swollen spleen can lead to it rupturing, but this is pretty rare.
So now that you know what mono is, what can you do to lower your risk of getting it? Since there's no vaccine against it, we can't fully prevent ourselves from getting mono, but we can dramatically reduce our risk by making some simple lifestyle changes. One example of a lifestyle to avoid is Snoop Dogg's lifestyle. Snoop Dogg likes to share drinks, kiss random strangers, share food, and share smoking paraphernalia, which are all classic examples of ways that mono can spread. So I really recommend to avoid doing anything Snoop Dogg would do to lower your risk of getting mono. However, though, mono can be spread through more than just saliva, as commonly thought, because it's referred to as the kissing disease. A lot of people think that it just comes from kissing, but that's not true. Kathy Crawford found that on college campuses, the way that Epstein-Barr virus is most commonly spread is actually through penetrative sexual intercourse. So using a condom or abstaining from having sex is very helpful for lowering your risk of mono. Other ways you can protect yourself are, again, to not share saliva, so you don't want to share any smoking paraphernalia, kiss strangers, share food or drinks, or share toothbrushes, and then also avoid sharing organs, blood, and semen by not getting organ transplants or blood transfusions from sketchy places, and use a condom or abstain from having sex to lower your risk of getting the virus.
How is mono treated? Currently, there's no treatment for a viral infection like mono. Doctors typically recommend over-the-counter antibiotics such as ibuprofen to help reduce symptoms such as a sore throat, fever, or any other type of pain. This is why treatment really only involves self-care. This means that getting sleep, eating healthy, and drinking lots of fluids to stay hydrated is very important when having mono. Although most people recover in 2 weeks, some people can have symptoms such as fatigue last from 3 to 4 weeks. Mono vaccine. Currently, there is no vaccine for mono. The mono virus hides in cells, which makes it hard to attack. The mono virus also triggers a rare type of cancer called Burkitt's lymphoma. This cancer starts in the immune cells called B cells and is a fast-growing type of cancer and can be rapidly fatal if left untreated. This is why any vaccine created can also have the potential risk of carrying this type of cancer. Researchers continue to work against this problem to try and create an effective vaccine for mono. For now, all you could do is try to stay healthy and away from mono.
Preventing mono is important because the symptoms don't occur until a couple weeks after contraction, which means you can pass it on to others without knowing, and they can pass it on to other people without knowing. There are currently no medications and vaccines to prevent mono other than medications that help relieve symptoms, which often prove unsuccessful. One of the 2 most common symptoms is fatigue and swollen lymph nodes, which can be very painful while eating, and you don't want to be remembered as the person who passed mono to someone else.
Okay.